Good evening, members. I want to call the Committee of State and Local Government and Veterans back to order. We're in recess from earlier this afternoon, and I am grateful that we are here this evening to do a little work regarding the issues that have emerged at the Hastings Veterans Home. I've invited Senator Seeberger to join us this evening. She represents that area of the state of Minnesota in her term as a member of the Senate, and I thought it was important that she join us. I do want to just lay out a little bit of what to expect for this evening and what brought us here, and what I hope that we are going to accomplish together tonight. And I want to thank you all for being here. It's March 21st. And we are about halfway through this term of this legislature. And when I came into the work, right, when I learned that I was going to chair this committee, that is state government and local government and veterans, I was really pleased and really honored. And one of the first things that I did was reach out to the administration and reach out to Commissioner Herkey, because I had done work with the veterans homes many years earlier, both in my work as a registered nurse and then my work in the Minnesota House. And I thought it was important to touch base with the administration, with the commissioner, and to let people know that as part of this committee, I was hoping that we would be able to visit, meet with, and just check in with the commissioner and with the folks at the various veterans homes across the state of Minnesota, because it has been a place where there has been trouble in the past and where in concerted effort we've made real good progress. And you will hear, I think tonight, a lot of support regardless of our political party or our geography, for the support of our treasured veterans. We spent this earlier part of today hearing a number of bills, Democrats and Republicans, that will become the subject of our Veterans Omnibus Bill. So I think that it is important for us to come together, again, with the idea that we, as Minnesotans, support our veterans, including their care and their well-being. I was lucky to visit the Minneapolis Veterans Home the night before we took the term of office, this term. So the night before we all took the oath of office, I joined Commissioner Herkey and others at the Minneapolis Veterans Home for a tour to see the progress that had been made since we'd done work together back in 2007. And there had been a remarkable change and remarkable improvements in the Minneapolis Veterans Home. And we took that a step further then in the middle of January, and we did our first state and local government and veterans committee field hearing. And we did that also at the Minneapolis Veterans Home, and it was a snowy and cold evening. I remember that, but we spent a couple of hours at that veterans home, and we had testimony from the people who work there. We had testimony from people who care deeply about veterans, whether they are connected to the veterans home or not. We heard testimony from the people who get their care there. There were 2 veterans that spoke that evening. And it was a really important, I think, foundation for the work that we wanted to do as a committee in serving our veterans, to be in that place, to see it, to hear from the people who are getting their care there, from the people who are doing their work there, and from so many people who are committed to the care and well-being of veterans. It was an important moment for this committee. It was shortly after that I got the first communication to our office about some of the concerns that people were having at the Hastings Veterans Home. And I will say that we have been deliberate and methodical, and I think thoughtful in understanding the issues that were coming from the people who work there, so that we could put ourselves in the mindset of what do we need to do about this question? What do we need to do with the information that we're hearing? There has been subsequent reporting in a number of our news outlets about concerns, and then action taken by the commissioner just recently. I want to be really clear that Commissioner Herkey has been very, very cooperative, forthcoming, and his commitment to veterans is crystal clear to me. It was crystal clear the night that we were in Minneapolis for the tour. It was crystal clear the night that we were together for that field hearing, which was I suppose if you think about your workplace as your workplace, perhaps an imposition that we were there. But we were welcomed, and we did important work on that evening. So I want to make sure that we are coming to this conversation with curiosity, with inquiry, with the hard questions that we need to ask for ourselves, so that when we're done, we are able to move in a direction. If there are things that we need to do as a legislature, when we think about public policy, when we think about budget, that we have better information to inform that decision making. I think it's also really important for the commissioner and the folks at the Veterans Home to share with us where they've been and where they plan to go. And that where you plan to go is also going to help inform us. One of the important roles of the legislature is oversight. This is oversight. This is us digging in a little further, hearing from various stakeholders, if you will, the parties who have had their hands in this, to make sure that we understand where we're at, so we can make some decisions about where we're going to go. And I think we should do that in the spirit of service to our veterans, to their health care, and to their well-being. And I just want to lay out that as a foundation, so that we can do this work in the next 90 minutes or a couple hours, and get on with the work of the care and well-being of our veterans. So with that, members, do you have any questions before we begin? I know Commissioner Herkey is here. He's had a full day. He's already had a listening session in Hastings. I'd like to invite him to join us, if that's okay with you. Commissioner Herkey. Welcome, all of you. I'd be grateful if you'd introduce yourselves for the record. And then you can begin, Commissioner. It's good to see you. I hope you're feeling well.
Thank you, Chair Murphy. Larry Herkey, Commissioner of the Minnesota Department of Veterans Affairs. And with me today I have...
Sure. My name is Caroline Schauer. I'm a nurse. I am the Clinical Director for MDVA Healthcare.
And good evening, Ben Johnson, Legislative Director for MDVA.
Thank you, Commissioner Herkey.
Thank you, Chair Murphy. Thank you for the committee. Appreciate the opportunity to talk about this issue this evening. The Minnesota Department of Veterans Affairs is honored and committed to provide highest quality of care to the veteran residents of our state veterans homes. We are also dedicated to creating a positive and collaborative work environments for our staff. We take seriously the feedback by former and current employees of the Hastings Veterans Home. MDVA leaders and human resources staff have worked closely with the Hastings Veterans Home employees to listen and respond to their feedback. As you know, I've decided to go in a different direction, as I've indicated to the Chair Murphy, as it relates to the home's leadership. And over the weekend, the last day for Deputy Commissioner Doug Hughes and Hastings Veterans Home Administrator Mike Anderson was Saturday, March 18th, 2023. We are moving forward with new leadership at the Hastings Veterans Home, and we are looking forward to continuing to make positive changes in service to our veterans. MDVA has initiated a search to fill both positions, and it is my intent to fill those within the next 120 days, but as quickly as possible. MDVA Programs and Services Deputy Commissioner Brad Lindsay has transitioned to the interim Deputy Commissioner of Healthcare. Craig Smith, who is a contracted individual and a licensed nursing home administrator, who has served as the interim administrator at several of our veterans homes previously, and has also been at the Hastings home previously, has assumed the interim role as the Hastings Veterans Home Administrator. There was introductory meetings yesterday with the staff and residents at Hastings and at Minneapolis today, and both were warmly welcomed. I want to address both the quality of care and staffing, which are two of the key issues. Regarding quality of resident care, in January, we conducted a customer experience survey of the Hastings Veterans Homes residents. The survey included 17 quality indicators that covered everything from overall care, nursing care, quality of food, and even laundry services. The results showed a 4.4 out of a total score of 5, which is above national average for those types of facilities, and it is consistent with our other homes as far as a score. And again, this is the residents providing this score, their feedback to us. We are also surveyed by both the Minnesota Department of Health and the federal VA, and the most recent Department of Health survey was completed in October of 2022, and a VA survey was just completed in January of 2023. A corrective action plan is currently being developed for the VA survey that we received, and all areas have been either addressed or corrected, and they've been put into place. And on the staffing side, and while the staffing during the COVID-19 pandemic has been challenging for all healthcare providers, we have retained most of our employees throughout this period. The Hastings Veterans Home, with 86 full-time equivalents, has a 7% vacancy rate as of today, which is 6 positions. That is the lowest vacancy rate of any of the state veterans homes of the 5 that we have in the state of Minnesota. In January, the VA survey found no issues relating to staffing levels or lack of specialized staffing, and I actually confirmed this directly with the VA themselves, with the chief survey officer. She got on a Teams meeting with me, and we talked about it, and her feedback to us is that our staffing is actually higher than most domiciliary staffings as far as both the number of people we have and the specialty care that we provide. In fact, we felt it was so important to have this level of care that we called it the Minnesota model and tried to get a little higher reimbursement from the VA based on the fact that our care is actually better than most domiciliary cares throughout the nation. We value our employees, and last summer we developed a 10-point plan in response to the employee feedback that I received. The plan has a few items which I'd like to share with you. One was on promoting the confidential lighthouse reporting system. We'll be restarting the sexual harassment prevention work group in April. We've provided performance review training for supervisors and managers. That was one of the issues that was brought up. Clinical training was provided to all staff, including mental health first aid. The maintenance issues that were identified as part of the items that I received, the maintenance, how to request maintenance has been taken care of and trained. And the audit procedures that related to the procurement issues that were brought up by staff have also been audited, and no findings were found in any of the areas that were audited. And we continue to expand our efforts. For example, today I was down at Hastings. I held 2 listening sessions. I was there with my human resources director, and we listened. I listened most of the time. I asked clarifying questions and received great responses from the staff, and many of them are behind me here today. Our DEI office is preparing and scheduling training for sort of anti-bullying, anti-retaliation, respectful workplace, and harassment prevention. And I can tell you the only reason we didn't do this earlier is I didn't have a DEI director, but now I do. So that training is scheduled and will be going forward. We are rolling out action items based on recommendation from the Employee Wellness Program to include increasing awareness about our wellness program offerings through EAP and Virgin Pulse. We are providing educational offerings for all staff in the areas of clinical education and in leadership development. And just recently, I also improved a communications specialist to go down and to assist at the home as it relates to creating more effective communications amongst staff. And we've also increased the presence of our human resources team from central office by sending them down periodically to have office hours also at Hastings. Because of data privacy laws and respect for the privacy for our former and current staff, we're unable to comment on specific employee allegations, but we tonight I can respond in general as it relates to any questions that you might have. We will continue to work through the individual issues that are still in front of us. Our work is not done. The 10-point plan that I put in place is about 60% completed. So we'll still be working on the issues that are still outstanding. And then I'll also be including the items that I heard today in my listening session as it related to broader issues, some of them facility related and procedure and so forth. I heard a lot of different areas. We'll be including those as we go forward also. And at this time, Chair Murphy, I'll stand for any questions that you might have or the committee.
Thank you, Commissioner Herkey. Do either of your witnesses would either of you want to say anything before we get started? All right.
No,
All
just
right.
go ahead with the questions.
Thank you. Commissioner Herkey, just right from, your testimony, you're making reference to a 10-point plan, and I'm wondering if it is possible for you to share that with us in more detail. It would be, I think, just helpful for us to understand. You sent to the committee, and I've shared with the committee when you sent to me your communication about the last days of the deputy commissioner and the administrator, and I appreciated that. And then you sent another document over with, here's where we're going to go, and I have shared that information with committee members. I would be grateful if you would be able to share the 10-point plan with us.
And again, overall completion is right around 60% of the items, so we haven't been able to get everything done, but we continue to work on it. The first item was review of work comp and safety records, and that particular item was completed here just recently. And that was actually quite a few of the areas that were covered were in that area, so we've done that. One of the next items, staff and even asked today, how do we report? Well, of course, they can report through their HR, they can report through their supervisor, but there's also an option to use Lighthouse, and we've advertised it now as a neutral option for staff and residents in order to report some items that they have of concern, and those will be brought along so they can do that sort of anonymous, and it comes back to us. Number 3 was maintenance request areas. There was some concerns about items that weren't getting taken care of, or how do I request it, or how do we get things done. So we've had the Arquebus retraining so that a work order, how that's done and how it's submitted and so forth was done. That was completed actually in December of last year. We retrain the procurement process. That's still in progress, so we have done a little bit of work with the specialists in that area, but we're going to try to train a larger audience in that so they understand the procurement process, so that we're always doing things the appropriate way, and so that is still ongoing. The number 5 and 6 are really focused on training, and the 5 was the anti-bullying training, which was one of the areas that was specifically brought out. The other ones were anti-retaliation, respectful workplace, and prevention of the workplace harassment training. Of course, we strive to get as high as, or the highest number of people that we can to do the mandatory training, but what I've required now is my DEI director is actually going to come up with scenario-based training that's going to allow allow staff to be able to watch a scenario, to be able to react to it as a group, and then provide feedback on what should have been done, not only for the person being harassed, but what's the role of the bystanders and so forth, so that we get everyone involved in the situation and people don't feel isolated. Number 7 was restarting the prevention of sexual harassment work group. That's in progress, and my understanding, the goal here is to relaunch in April of this year. Conduct performance review training for supervisors and managers. There was some discussion as it relates to who has the authority to do what and what should be put into performance review. That training has been completed for the managers and supervisors. Conducting ethics training refresher. We have not started that yet, but my general counsel will be performing that training, and that's scheduled to be completed here in the spring. And the last was audit procurement practices. There was 2 areas that were outlined specifically in the complaints. Both areas have been audited, and there was no findings in either area. Besides that, I did require EAP to go down and do their listening session. They did that in December. I was provided that feedback, and that feedback is actually informed, along with working with M&B, has informed some of my decisions and so forth that we're at today. And I think the only other thing specifically not on here was communications training, which was recently authorized, and we'll be entering in a contract for that to bring in outside help as it relates to communications training throughout the entire Hastings staff.
Thank you, Commissioner. I have a couple questions. One, logistical. And I know you can see the agenda, so there are not very many people who have agreed to come and speak with us this evening. But we have a few people who are going to come and speak with us this evening. And I'm wondering if you will be here for that, and if you'll join us at the end again, or if that's your plan to stay.
My plan, Madam Chair, was to stay the entire meeting.
That's great. I know the day has been long for you, but I think it's important, and I appreciate that. When I think about where we're at, you as the commissioner have taken some action over the weekend. Part of the stories that we're hearing about, whether it is through news outlets or in conversation with people who have been working at Hastings, is the sense that the workplace is hostile. There's a concern about retaliation, some about the ability to carry out professional healthcare responsibilities. So I think about, here's sort of the realm of concerns that people have expressed. You've taken action in terms of removing a couple of people who were in your leadership team that may or may not have been, we'll hear more, contributing to some of that sense of a hostile working place. You've got a 10-point plan to bring, your leadership to this work. And then the last thing that I think I'm hoping that we're thinking about and talking about is, are those 2 interventions the interventions that move us in the direction of where we need to go? Or are there other things that we should be thinking about in addition to those 2 things? And I don't mean for us to conclude that right now. I'm just thinking about that as we are heading into this discussion, and want to share that with you so you can think about it as well. Then I think I will stop asking questions and see if there are members here who have questions for the commissioner before we move on to the testimony.
Madam Chair? Oh, I'm sorry.
Senator Mitchell. I'll make a list. So Senator Mitchell, Senator Coran, Senator Seeberger, Senator Coran. Excuse me, Senator Mitchell.
Commissioner, thank you for the work that you've done on this. We were sworn in for this particular Senate in January, and we started hearing these issues almost right away. And as someone who's served for 30 years in the military, my experience has been toxic work cultures don't happen overnight. And so I I guess my question to you, because you've been in this role for a few years now, is how did we get to this place without having addressed it earlier? Because we started hearing some of these issues right away. And if we're getting to the point where we had to let go of some of the leadership, that means things had been happening for a while. And we're just hiring, for example, one of the letters we have says that people of color felt like they were roadblocked from any advancement in any role, regardless of their resume. How did we not have some of this earlier? Why are we just now getting a diversity and inclusion officer, for example? What got us to this point?
Commissioner Herky.
Chair Murphy, Senator Mitchell. Concerning the DEI officer, I've had 3 different ones. They've been hired away mostly by bigger agencies within the state. So my last one that we had here was just hired. I think she's in her 90 days or 120 days with me as of now. So I have had DEI officers before. It's just that there's been a bit of a upward movement within the enterprise. I was first aware of this when I received a packet in June. My intent was to take immediate action. I had my HR staff take a look at all the issues that were brought forward. In fact, we came up with a very detailed matrix, and I had them cross-level. Some of the allegations or concerns were quite dated in the documents that I received. If I remember right, there was 4 current employees. I think there were 6 past employees, and there was 5 anonymous with no names provided to me. But I took every one of them seriously. We worked through each one of those. We found in some cases the items were under investigation, so we continued to watch the progress as it related to those. Some of the items had been resolved, and the ones that had not been resolved were the result was the 10-point plan that I just briefed you to try to fix those items that were still outstanding that I felt warranted attention. And my other instruction was to go forward. It was clear to me that the culture at Hastings had some issues. So working through my deputy commissioner and the administrator, I made a direction as it related to creating a collaborative environment where all voices could be heard, and that it would be a positive workplace to work for our individuals. What I was not seeing is significant. We were knocking down the items on the 10-point plan, but I wasn't seeing a big change as it related to the culture. And that really was the reason that I took the action of this last weekend and decided that we needed to go with different leadership in order to be able to make a more comprehensive change in the culture at Hastings. There were problems before this. I think you maybe are aware of this, but back in 2017 and 2018, there were significant problems. I can applaud the administrator, the past administrator, for fixing many of the problems that actually existed then. Mike Anderson did a great job in many areas in improving the conditions at Hastings. And I think that, and Caroline could talk to that more, but the outcomes for our residents there have been continuing to be positive going forward. So in my opinion, at no time were the residents in a situation where we lacked the staffing or the capability to actually take care of the residents. That was proved by the VA survey. And we were improving the overall result as it relates to some of the issues that presented themselves in some of our residents. The challenge was it seemed like the culture, there just was something not correct there, and it was not a positive environment to work in. And some of those items were actually reinforced through the listening session that I talked to today. And if you'd like to, Caroline could talk to some of the positive results as it relates to our residents.
So I will just add, one of the things that the domiciliary program struggled with, it's a program where, unlike other states, this state has opened its doors to those who have been homeless, those with chemical dependency issues, those with mental health issues. And it really fills a need for veterans who otherwise don't have anywhere to go. And the VA has been a really strong partner with the state of Minnesota, which is why I left my service in the VA after 12 years and moved to the Minnesota State Veterans Home under Doug Hughes. I feel strongly about this program. I feel strongly about the people working here and the philosophy. Talking about that 2007 blueprint plan, it was a pleasure for me to go through that blueprint and see that my position was actually one of the ideas in that blueprint, is that we would have signed, stronger clinical leaders to be able to provide guidance and support. One of the things that I think has been difficult, because we have a rather interesting clientele, and they sometimes have difficulty with controlling their behaviors, their words, that sort of thing. It is a challenge to keep this group safe, occupied in very good occupational activities, work activities, that sort of thing. And then foremost is sobriety. So when I came, I heard stories of how many basically room searches had to be authorized, and the vast amount of alcohol and illicit drugs that were found in the rooms. Under Mike Anderson, we did not have that. He established that this was going to be a sober environment, and we were going to embrace sobriety. There is a chemical dependency counselor on staff who's extremely helpful and provides support to all of the veterans there. So that is really a huge success. Never mind trying to address all of their other mental health, physical needs. There's been a lot of work done to really improve the health and well-being of the veterans that we serve.
Senator Mitchell? Thank you. Senator Curran?
Thank you, Madam Chair. Commissioner Herke, I guess, many people are looking, and they probably many here have probably read all the details in the accusations. A couple things is that, one, I'd like you to cover, you can't talk about specific people or anything. We're not asking that. But I think people need to understand the totality of the accusations that were made. And at least in the area you talked about, some were under investigation, at least the types of issues under investigation. Some were resolved. How were they resolved? And then some were, or at least what the accusations were. And then the 10-point plan is going to resolve the rest. The challenge I have is what you described in the 10-point plan sounds like everything that should have been in the daily plan of the entire operations under your leadership. And so I'm wondering, what changed? You said you first became aware of at least a group of accusations in June of 2022. You didn't state the year. I'm assuming it's 2022. And to then come here today and say, because we didn't get here overnight, and I'm sure those accusations, I think some are dated, some are old. We got here from I think the testimony when we were on site was many years of not being responsive. And so when you talk about the retaliation, I think those are some of the claims and the harassment. I didn't hear anything that's going to fundamentally change. And so I'd love to hear about, you got rid of a couple at the top, but I've heard surveys, they're great, But what I want to hear about is how many staff do you have that are in admin that don't work the floors of your facilities? And when you found out about them in a very short period of time, since we were just at the hearing, in your confirmation hearing, and that miraculously half of it's been resolved, I want to know what's going to be really different. And how are you going to make sure to attach your staff who manage those facilities to real substantial change? And I would love to help with it, because I think that's a fundamental change or issue that we have across all state government. We got great people, but are we empowering them? And do we got rule makers? You head the rule makers. And are your rules creating challenges for the staff that work in the environment that don't reflect their work or don't reflect what they do? And are people that are writing those rules living by those rules in your facilities today? Because my biggest concern is you're going to open 3 new facilities. How are we going to staff them, first off? And then how do we make sure none of this is carried over into those environments into the future? So I know there's a lot there, but accusations, your 10-point plan should have been your daily plan anyways, and we got here because of a broad systems of failures, which you were the head of. And so I think we're going to need more meat on the bone about what's materially going to change in the fundamental basis about how you support your organization, because I think the one thing we can all share is I don't like the waste of a dollar, but when our outcomes are poor and it affects our elderly, our disabled, and our children, and certainly our veterans that meet those categories as well, I don't think we have any patience for any type of poor living condition for any reason. And we'll support you and run alongside, but we're going to need to see some creativity in how we're going to address this. So thank you.
Commissioner.
Chair Murphy, Senator Coran, a lot there to unpack. I'll try to get as many of them as I can here. One, the 3 new homes will be a challenge to get the appropriate skill sets into each home. We're going to be hiring somewhere between 400 and 500 people. That'll be a mixture of full-time and part-time individuals. And I think can tell you that the retention and the hiring bonuses that we put in place, I believe, will help us. That this is the first time our agency's ever had that capability. I also believe the quality of the leaders, starting from the top. In the case of the administrators, I've got a chance to interview all 3 administrators, the new ones, and I can tell you, I believe to a person, they have the right type of attitude, they have the right experience, and they will lead their homes quite well going forward. And we'll continue to work on those new homes in the hiring process. Right now, we're in single digits with individuals for each home, but we will continue throughout the summer time frame. The 10-point plan, Senator Coran, I can agree with you. Those things should have been, there shouldn't have been problems as it related to respect in the workplace. We'll just take that as one item. That's something that's taught. It's reinforced, throughout the time that a person is an employee in the state employment. The challenge is that the individuals all the way down need to represent those same what do I call it, attitudes as it relates to the person at the top setting the example for others. And in this case, it was clear by the information I received both through the EAP listening sessions, through individuals contacting me directly, and through the original complaints in June, that there was an issue in some of these areas that should not have been a problem previously. And that's why I directed the retraining in those areas. And in the case of some of the items, the audits or the investigations, in order to ensure that there was no problems going forward. It became clear to me, though, at some point that the person at the top actually sets the tone for that. And that's why I felt it was important, as I said in the letter to you, that we make a change. And I think it's incumbent upon me as the leader of the agency to make sure, just like I did for the new homes and through the selection process there, that we get a person that can represent and walk the walk and have all the great things that we want in a leader for our state veterans homes. It's a tough job. I heard about it today from many of the staff. I think most of them thought it's almost a job that's almost impossible to do, but it has to be done. And we have to hire the right people that will enforce the standards, that will make sure that the attitude within the home is collaborative, it's positive, and that people feel like they're heard, no matter if you are a resident or if you are a person that's on staff. So my commitment to the committee is to find that right person, or in this case, 2 people, and put them in place and make sure that this issue is not an issue in the future. I do believe I need the 10-point plan, though, to bring us back in and make sure that everyone understands what the standards are, and it'll be up to that new leader and myself to make sure those standards are enforced going forward.
Madam Chair?
Coran.
Madam Chair, I know there was a lot in the Coran rant earlier, but it highlights some of the allegations, those that you resolved, those that are under investigation, and those that you think are still outstanding. I think we get it, some basic procedural training, but on your 10-point plan. But so at least cover for people that don't know what the allegations were, at least at a high level, of those that are resolved and those that are under investigation.
Commissioner.
Senator Murphy, Senator Coran, many of the items that were brought forward were resolved, like the sexual harassment issue had been resolved long before I received the packet in June of 2022. It was documented, there was information there. The items as it related to procurement, the 2 different areas that were identified, we had no record of that. So I took corrective action, the corrective action being conducting an audit of those 2 areas, and in this case, I found no findings. I don't have a list of every single item, but I can tell you that the 10-point plan covers most of the items that had not been covered previously. So those items were items that needed additional attention, and the other items that had been resolved, we just checked on it to make sure there was any outstanding issues, and in some cases, we felt to do some preventative work would be important, and we've done that we put that in place as part of the 10-point plan going forward. I guess I'd leave it at that.
Madam Chair?
Senator Coran.
That'd be my last follow-up. Commissioner Herke, so you describe you want to get better at being accessible, but you've been the guy at the top for many years. And so I would recommend that you not only retrain, but you actually do something differently. And what I haven't heard is anything different yet. And so I would suggest that, again, I would love to work with you because we need to pilot somewhere in state government to institute a system of training where everybody wins. Your staff on the front lines. How many managers do you have? Or how many staff do you have in your organization that don't work in a nursing home or in a care facility or in one of the homes? Is it 50-50 administration to those that are on the front lines actually providing care? Or is it 30% in administration? At least give us a ballpark to understand what we're dealing with.
Commissioner.
Senator Murphy, Senator Coran, we have a multi-dimensional agency, and part of the agency has nothing to do with health care. So all of those individuals, over 100 individuals, are in our programs and services area. I have about 60 individuals that are in central staff. Their job is, to do things, HR, general counsel, DEI director, commissioner, and so forth. Our daily work is not directly related to the health care. The overhead within the homes, though, majority of the people, and Caroline can back me up, but the majority of the people have one or more roles as it relates to care within the facility. And maybe Carolyn could define a better percentage, but I can tell you that most of the people within the homes have a direct care relationship with the residents in the facility.
Thank you, Madam Chair, last question, or not last,
Senator
but
Coran.
Commissioner Herkes, I would suggest that those that you deem, and admin, and everybody that touches those homes, regardless of the position, I think you all should go work side by side with your staff on a regular basis and do the job. Be certified in the job in which you, right, whatever the lowest level of certification is, and go out there and actually do the job as much as you can. I know we have highly skilled trained staff, you know, nursing and all those things. I don't expect anybody to do that. But I think you're going to have to do something a little bit different. You're at the top of the food chain, and this all happened under your watch. And so I think something different has to be done. Because all you've talked about is redoing the training you've done at some point in the past. And so I think really to have that attachment, we need the buy-in, right? In not just the accessibility to you, but to be able to show them, have them show you what they live and what they do on a daily basis. And I think that's the only way we'll get attachment and really create an environment where the employees win, you win, and everybody in the food chain can assist each other. Because talking about what you do and having a listening session is very different than actually boots on the ground, you know, and doing the actual job. And I know you've done plenty of that in the past, but I think that's one of the things you're going to have to try to do differently. And everybody will win. And I would love to work in any way we can to try and help with that and figure out how we can improve that whole training process, because we'll all win at the end. So thank you.
Senator Seeberger.
Thank you, Madam Chair, and thank you for allowing me to be a part of this discussion. Commissioner Herkey, thank you for being open to conversations with my office about this issue. The Hastings Veterans Home is near and dear to my heart. My husband is a 30-year member of the Navy. My father's an Army vet. My father-in-law also had a career in the Navy. So the veterans are very special to me, and this issue is something that's very important to me as well. You mentioned that you first became aware of the current issues this past June. And when I spoke to you last week, we did talk about the 10-point plan, but then over the weekend, you decided to make this change, and you said you decided to go in a different direction. And my question is, what motivated this determination that now it was time to go in a different direction, and what factors went into making that determination?
Commissioner Herkey.
Chair Murphy, Senator Seeberger, it's good to see you again. And I too very much appreciate your support as it relates to the Hastings home. The reason that I decided to go in this direction, I just wasn't seeing movement as it relates to the culture. And I was still getting feedback even after getting the initial concerns, and then the follow-on listening session that was done by EAP. Plus, I was getting individual calls from individuals still as it relates to their concerns of what was going on within the Hastings Veterans Home. I just, working through the deputy commissioner and the administrator, I wasn't getting the support that I thought to get to that collaborative environment where people can work together, respect each other, and listen to all the voices within the facility. That was reinforced actually by my listening session today. You know, there was many concerns that were brought up as it related to behavioral health was probably the #1 item, and how the staff feels that we need more capacity there based on our clientele, and that you know, we really need to look at what we're doing in that area to be successful going forward. I'd received a lot of informal and formal feedback. I was also receiving feedback through the legislators and their constituents. I'd received quite a few calls and specific inquiries, and I took that in consideration too as I went forward. I felt that there's no way that we're going to get to where we need to be and make some of the long-term changes that are required to make this a productive home as the other 4 homes are in the state of Minnesota. I'd never felt, I'd been to Hastings actually 18 times that I could remember, in different capacities, so everything from distributing Christmas presents to doing inspections of facilities to being there for official delegations and ceremonies and so forth. And during that time, I know the one time I was down there, I talked to every resident that was physically there because I went into every room. So the focus I have, I think, was not that I felt that there was a problem with taking care of the residents. I think there are some issues that need to be resolved there, but I don't believe at any time where was there a resident that was in danger or in peril. And I know based on my feedback that I've got from the federal VA and based on my review of the MDH and VA standards that we meet or exceed all standards and actually have more capability than most domiciliaries, but there still wasn't that, ability for us to bring all of our staff together and effectively operate. And I can't tell you exactly what the missing component was there, but I know as a leader for 30 years of my life, it starts from the top, and the person at the top sets the tone. And that person has to respect every single person that's within their authority and be able to value them and listen to them. And in this case, I felt there were some issues there based on the feedback I was getting, and that there needed to be a change in order for me to get to where we need, which is harmony, because if the staff is working together effectively, I know the residents and the veterans will be taken care of, and we'll be able to accomplish our mission in the facility.
Senator Seeberger.
Thank you, Madam Chair. Commissioner Herky, and thank you for that answer. You mentioned the listening session today, and I believe you mentioned that there were certain things that you learned today that will be implemented either in the 10-point plan or in additional action items or plan items moving forward. What sorts of things did you learn today that you are going to be acting on?
Commissioner Herky.
Chair Murphy, Senator Seeberger, probably the one that surprised me the most was the behavioral health shortfall and some of the concerns that were brought forward in that area. I heard a lot of different areas from policy letters that need to be updated. There was some discussion as it related to facilities. There was quite a few people, in fact, some people came up to me afterwards and talked about facilities. A lot of discussion about, how difficult it was during COVID to be able to do infectious control in the facility, the way it's set up in, it's set up more like a college situation where the bathroom is down the hall and you share your dorm room with another person, so it gets to be very difficult. So I heard a broad number of different items. I had note takers taking them down, but I would say the biggest one was particular staffing areas, and specifically behavioral health was probably the biggest thing that surprised me. The other one that really I'd been aware of, but I think it was brought to my attention very closely, was in some cases we're probably trying to take care of folks that are beyond what the domiciliary is supposed to provide as far as a care standard, and they really should go on to long-term care or at least assisted living, based on the fact that their daily needs are much greater than probably what a domiciliary is actually staffed at or meant to take care of. So that's an area that I've directed, actually my new interim deputy commissioner and the interim administrator to review each individual that's there and their needs for each individual to make sure they're still a good fit for the domiciliary. I think that's actually creating some stress within the staffing because they're trying to cover and do a lot of things that really a domiciliary normally would not be asked to do. And And Caroline, if you want a greater evaluation of sort of where domiciliary is, but really it's to provide, take care of the daily meds, take care of some of the routine needs and so forth, but it should not be getting into a situation like a long-term care where there's, a need to have a greater percentage of staff in order to support the residents that are there. So that's one area that I want to look into, because we got to either balance the staff to meet the needs of the veterans, and then we're getting closer to long-term care, or we have to be able to move the people along to the next highest level of care in order to not overstress the staff. So that was one concern that I was a little bit aware of, but it was made quite, there was quite a few people that discussed that issue during the listening session today.
Senator Seeberger, thank you. Thank you, Commissioner. I'm glad you're going to stay. We have others who are going to testify. There is something that was mentioned earlier, and you've just touched on it, and I think, I want to raise this because I think it's probably going to be something that we come back to. The veterans who live in this Hastings facility, as they were described, are people with, mental health issues, substance abuse disorder, they have chronic conditions. We've heard some from the letters and the comments that we've gotten that some have dementia. I don't know about that, but I have wondered as I have listened to this issue unfold if there is misalignment or if the population itself, and they are, as I say, they are our treasured veterans who have lived a full life. They have defended our freedom, and they may be carrying with them the wounds of that work in the way that they are living right now. And this is something, we experienced so many years ago when we tried to restore funding for general assistance medical care, and the population that were getting their coverage through that program were, as the commissioner at that time would say, the poorest of the poor and the sickest of the sick. I don't know if that is the right description for the people at the Hastings domiciliary, but I am wanting us to come back around to that question. When you are referring to behavioral health and the needs, or the chronicity of the people and their needs, I think that there is an open question for me there that we should pursue a little bit further, and I'm glad that you're raising it here tonight. And if there are no further questions, Senator Anderson has a question for you, and then we're going to move on through the testifiers. Senator Anderson.
Thank you, Madam Chair. Looking through this executive summary that's been set before us, this goes back to November of 2007, and in there it talks about governance. And I'm just wondering, with the new vets homes coming on board, Preston, Montevideo, Bemidji, I see that under the executive summary here that was recommended that they transferred the Veterans Home Program at that time to the MDVA. And I'm just wondering, by adding these extra vets homes coming in and the extra amount of work and things like that, if reversing the process would help in the stress of doing things and go back to a separate agency rather than having it under the umbrella MDVA, just asking the question, because it was changed at that time, and according to this, they had troubles at the vets home, specifically Minneapolis at that time. So, and they've come up with some points of how they were going to try and restructure and do things differently. But so to me, it was only in one home at that time. It was Minneapolis. Here we're talking Hastings and Minneapolis. And I've had conversations with people before where in healthcare, I said, have you gone to the ombudsman and talked to them? I asked the same question when I got the phone calls from people here, have you talked to the ombudsman? And they said, the ombudsman said, we can't get any help. So I'm just wondering if there's a roadblock there where even people who are supposed to be outside of the system, they can't get through a roadblock that's somewhere MDVA's higher up? Is there a need for restructuring? You're talking about 10-point plan, but I'm wondering if we, sometimes going backwards isn't all bad. Your comments?
Commissioner Herky.
Senator Murphy, Senator Anderson, great question. I was not here in 2007. I think I was deployed to Iraq at that time in combat, but I did read the report. I looked at the recommendations, and I think the appropriate action was taken at that time. I think what I read in there was the board that was responsible had a very small oversight, and their board of directors was supposed to be a lot of medical experts, and what I was told is a lot of those individuals over time were political appointees that probably didn't have as much medical experience as they should, and therefore the direction of the board and the oversight sort of slipped away. I think that the professionalism we have in our staff with people like Caroline and Paula Nowinski and some of the other individuals that we brought to the table have significantly increased our ability to meet the standards, both for the VA, for CMS, and also for MDH. And I believe by putting it under MDVA, that we're going in the right direction. I want to assure you with the new homes, I've made the appropriate changes in our staffing, both at the central health care area and also in my central staff, to be able to take the greater volume of whatever issues come our way, whether it's a legal issue or it's additional contracting, or if it's additional need for oversight. I've actually restructured some of my central healthcare staff in order to be able to have appropriate oversight for the new homes coming on board. So I would say that we're going the right way, that we've significantly improved since that 2007 timeframe. It's my understanding, and Chair Murphy can tell me if I'm wrong, but there was major facilities issues, there was major care issues, there wasn't a lot of oversight or quality control, that they were having difficulty meeting their survey requirements. I mean, it was sort of across the board, is my understanding, and that even at that time, the resident satisfaction was quite low because of all the issues and the turmoil and so forth related to either the facilities and or the operations of those facilities. So I think to answer your question, Senator Anderson, we've come a long way. I think we continue to get better. I think if I were to take you to Laverne, Fergus Falls, or Silver Bay, you would hear from those families and from those veterans that this is the best place ever. And I would like to also say, and I just respond back to sort of the last question. I asked the staff today, I said, why, if the veterans having such a difficult time, why would they want to stay here? And they said they want to stay here because they like the staff, they like the place they're living, it's their home, and they rather die in place in that location than go to somewhere else, because they enjoy so much their ability to be at the Hastings home, and that's why. But we owe it to those veterans to make sure they're getting the right care. So, as Senator Murphy has indicated, I think we need to do an evaluation. But to answer your question, I believe it's best it stays under MDVA. And I do have oversight, Senator Anderson, in that the American Legion will go to my homes and I get a report annually from them. I know they're going to be testifying here in a moment. You could ask some questions of them. I also get feedback through the Commander's Task Force. Throughout the time period, each one of the Veteran Service Officer Commanders get a chance to go to our facilities too, them and their staff, and I always get feedback almost every month as it relates to one of the homes, as it relates to something they either really like or something they have a concern about. And I take all of those inputs from the Commander's Task Force seriously. I also take the input and the feedback I get from the American Legion through their evaluations of our home seriously also.
Thank you, Commissioner.
Yeah.
All right.
Thank you. Thank you, Madam Chair.
Madam Chair,
Senator Anderson.
I hope that we have opportunity to redirect some more questions later on. And
The Commissioner is going to stay. He said he would stay with us and come
Thank you.
back at the end if there are questions for him.
Thank you.
You're welcome. So we have 5 people on our list, 4 more people on our list. The first is Lynn Wackler. And following Lynn will be Mike Maxa, then Hillary Grover, and then Jim Meyer. We'll take you one at a time. Welcome to the committee.
Thank you.
What I'd like you to do is introduce yourself for the record and then proceed with your testimony.
My name is Lynn Wackler, and nurse practitioner for Hastings and Minneapolis domiciliaries.
Diane Groth, RN, for Hastings.
Carissa Humphrey, former RN at the Hastings Vets Home.
Welcome to the committee.
I'm also former.
Please proceed, Ms. Wackler.
Madam Chair, members of the committee, my former colleagues, and fellow Minnesotans. My name is Lynn. I'm a registered nurse and hold national certification as a family nurse practitioner. I have 34 years' experience as a nurse and 25 as an NP. I was separated from state service in October of 2022. While there's not time tonight to share a comprehensive overview of my time with MDVA, I hope to highlight a few key experiences and observations which I hope may offer validation that the recent changes were necessary to ensure our veterans receive the care they earned as a benefit for their military service. Initially, I joined a highly functioning team of providers in Hastings in 2015 with 2 nurse practitioners and a designated part-time physician for approximately 150 veterans. I was a contractor for a year, and I enjoyed the position so much I signed on to full-time service in 2016. I too come from a family of veterans who have served in every war, including World War I, during which my grandfather was gravely wounded and received a Purple Heart. Since 2016, under the initial leadership of Doug Hughes, Agency Medical Director Dr. Bruce Meyer, and Simone Hogan, there were significant cuts in key positions, which ultimately created an extremely lean workforce without systems or processes in place to mitigate these changes. By late fall of 2018, our designated MD, Dr. William Korchak, our full-time nurse practitioner, and our half-time nurse practitioner had left under duress. The contract of Dr. Abraha, who provided services to the Minneapolis residents, ended, and the 2 program sites were consolidated. Our best systems and process thinkers and builders who specialized in education, infection prevention, and informatics, to name just a few, left under duress. Our mental health services were also gutted with the departure of our staff psychologist and behavioral analyst, and then later our contracted psychiatrist, Dr. Sharoma. Can you imagine having to resign just 2 weeks before your 5-year vesting date? That was our workplace. With a caseload of 1.5 to 2 times community standards, I tried to discuss these staff reductions and appropriate caseloads with data I had collected from other healthcare systems, such as Allina, Bluestone, Health Partners, and even our own agency provider caseloads with Senior Director Simone Hogan. As an agency leader, I felt she was dismissive and belittling. She refused to look at the spreadsheet I had presented for her review and consideration. Today, more than ever, we need high-level leaders who validate employee concerns, listen with compassion, and inspire with meaningful actions. I continued to work with my union, as did others, throughout 2018 and into 2019 until I felt my job was threatened. It was, in fact, 3 times. I can also attest to witnessing staff splitting, diverting blame to others, and even name-calling, in some instances, by a senior leader who is still employed. Through the extraordinary efforts of nurses and many other caregivers, we still manage to provide overall good care by creating our own systems on the fly. Frontline staff put in place safeguards and processes which ensured a safety net that enabled us, for the most part, to avoid sentinel events. The additional workload of creating these systems took a toll over time and increased staff burnout. Even pre-COVID, nurses and staff began to experience increased stress levels due to excessive workloads. This stress rose exponentially with the onset of the pandemic. With our 4th Director of Nursing within just a few years, our new Director of Nursing, Tori Pierce, wrote, "We were laser focused on preventing and mitigating the spread of COVID. All the staff at the facility knew that the layout, communal style living with shared rooms and bathrooms, put veterans and staff at risk for rapid spread. We deployed immediate response line testing, quarantine, isolation. Left without an infection preventionist because of the pre-COVID cuts, our quality nurse voluntarily accepted those additional duties when asked by senior leadership. Our COVID unit was actually state-of-the-art, despite being constructed with supplies we found around campus, and all of us were very proud of the work that went into it. With little or no PPE initially, we sewed gowns, we wore swim goggles, and shower caps. We were under tremendous stress due to lack of PPE. In a letter to Commissioner Herkey dated March 30, 2020, our union reported potentially unsafe OSHA violations that were occurring in our workplace, including this lack of PPE and short staffing. Again, due to the cuts, there were no other providers at the Hastings home when the agency medical director's work with the outstate homes during the pandemic took priority. For many months, I was the only primary care provider on site. There was no time off. Myself and many others remained constantly on alert. Eventually, the PPE situation did improve, where we received 1 mask a week, then 3 masks a week, then once a day. Keep in mind, masks are for single use only. The veterans were fully vaccinated by February of 2021, but by spring, key injuries and family emergencies left few RNs to manage the nursing and medical needs of approximately 120 veterans in Hastings, plus the 40 or so in Minneapolis, many with very complex medical needs, while other non-nursing positions were created. During the early peak of the pandemic, there had been a few pool nurses, but that was temporary and had ended. As former frontline employees, we had stayed in touch. We found many of us with shared histories and similar experiences with our place of employment. Almost unbelievably, there have been at least 53 staff resignations in Hastings alone in less than a 5-year time period in a workplace of approximately 85 employees. I know because I called almost all of them. Almost half had filed grievances, complaints, settled claims against the Hastings Veterans Home. As battle buddies, many of us who had quit under duress were walked out or forced to sit out, got together for support and to provide check-ins for one another. I recall asking one of the group what she had accomplished that day. Her answer, "I managed not to kill myself today." That was not the first mention of suicide. In fact, in one of the letters to Commissioner Herkey, a nurse writer mentions her thoughts of suicide. Her name and phone number noted clearly at the bottom of her letter. Despite all the dollars the Healthcare Division has spent on mandatory suicide awareness and training, not one MDVA agency personnel reached out to a frontline worker with suicidal ideation until well after all complaints were closed. Another letter writer did make an attempt, which was highlighted in the packet we forwarded to state officials. Deputy Commissioner Hughes and Mr. Anderson's response to workers who were approaching burnout levels was to force them to rotate shifts, work weekends, compounding their fatigue. Performance manage, he said. It's difficult to do with state employees, he commented over the weekend. We believe these comments speak for themselves. Caregivers simply quit or retired. Recent studies report unprecedented numbers of nurses and other caregivers are currently suffering from anxiety, depression, PTSD, or all three. The Healthcare Division of MDVA did little to address the needs of frontline staff and meanwhile increase management presence. In the Minneapolis DOMS, mid-May 2022, just prior to sending our letters to Commissioner Herkey, one nurse worked 21 hours straight. Shortly after, the Surgeon General issued a warning May 23, 2022, regarding crisis levels of burnout in our nurses and other healthcare workers. For myself, I collapsed in an exam room on July 20th, 2021. I left in an ambulance with a cardiac event, and my recovery included hospitalization, physical therapists, and mental health therapists. I have no shame or stigma around sharing this with you tonight. If you are to have a healthy workforce, you will need to address what can be the elephant in the room. From the day I collapsed until the outbreak in 2022, there was intermittent, or many days, no primary care services. In the weeks leading up to the pandemic, there was no primary care provider. In fact, my name was on the chart of the deceased. I was listed as the veteran's primary care provider, and I had not been in the building in 15 months. Primary care providers are powerful advocates for their patients. They ensure vaccinations are administered, including COVID boosters, on a timely basis. Mr. Anderson's comments that all guidelines were followed during the outbreak was a misrepresentation of facts. Primary care providers ensure senior leaders are aware of situations that could be jeopardizing veteran safety and are required to sound the alarm when necessary. Senior leaders in the Healthcare Division have been aware of the long-term issues that have affected care in veteran services for years. I know this because I told them. I highlight a necessary snapshot of the psychosocial services being provided today. In the past, there were 5 staff social workers to provide these very key services. Today, there is just 1 remaining non-management social worker to manage the complex needs of veterans in both Hastings and Minneapolis, approximately 140 veterans. The frontline staff will tell you this is not good effort. In Hastings, replacing middle-aged women with younger male workers across the board in supervisory and management positions is not the right direction. In Hastings, the devaluation of strong women's opinion, widespread fear and retaliation, and underrepresentation in leadership positions, especially for our BIPOC members, is not the right direction. Whether this is diversification of the workforce due to attrition or efforts to reduce employee health care costs, neither are acceptable. And stress, it's not just a personal issue, it's a workplace issue that must be addressed. Where do we go from here? We need leaders with more heart and better hearing, with the drive and determination to get this right. We need close examination and accountability of remaining senior leaders in the healthcare division of MDVA. Be strategic and thoughtful in how to assess and then implement organizational and cultural change from the ground up. Shore up safety standards by admitting veterans who are appropriate for board and care services. Identify and address safety issues in and around the facility, which include improved staffing ratios and violence prevention strategies. Hire strategically. Invest deeply in onboarding with comprehensive orientation, clear expectations, and ongoing education. Consider a designated domiciliary nurse educator, infection preventionist, possibly a daily flex nurse who can help with admissions or during busy times who can double as a project manager or a systems specialist. Involve veterans in the decision-making process around what cares and services they would like to see on their campus. Adopt standards that guide best practices, including the quadruple aim, which includes monitoring the well-being, enhancing and monitoring the well-being of the healthcare team. I encourage you to increase provider staffing to include expanded hours for primary care and/or a designated medical director who will willingly and rapidly assume those duties if necessary. Again, there was only intermittent primary care in the year leading up to the pandemic, and the federal per diem guidelines state that veterans must be receiving both necessary preventative care and appropriate medical services in exchange for the federal daily rate set forth. Last, our BIPOC members are underrepresented in positions of management, senior leadership, and agency leadership. They continue to fear retaliation for speaking up. Challenge the status quo and adopt a wider lens when thinking about key new hires. We can be the change. I know this from experience. Thank you for allowing me to testify here tonight. It has been my honor and my privilege to be of service to our veterans.
Thank you, Ms. Wackler. Thank you for your testimony. Members, do you have questions for this witness? Senator Mitchell?
Thank you for that very important and moving testimony. I have a couple questions. My apologies. One, we were told in previous testimony that the staffing was very good, only 7% short, but you represented that the staff was leaned down. Mm-hmm. So do you believe that the staffing, what is considered appropriate staffing, is actually adequate staffing? And do you believe that the critical types of positions across the board are adequately staffed?
Ms. Wackler.
Madam Chair, I don't believe the staffing is adequate for the level of care of the veterans we're serving today. What happened during the staff reduction and cuts is many positions were combined together, making it hard to track exactly where the cuts were. The key cuts necessary, I think, to ensure exceptional care should not be combined with other positions such as a care coordinator and an infection preventionist, a care coordinator and a quality nurse. Those used to be individual positions, and I stand that they should still be. I believe the MDH survey findings during the outbreak with regard to staffing and inadequate care speaks for itself regarding staffing levels.
Senator Mitchell.
And again, you have my empathy as I've worked in a toxic work environment. Even if you're trying to do your best, it can be hard to focus when those external things are going on. And especially serving veterans, very relational. Where they want to get to know you, you know their needs, you know their history. And what I'm hearing is that even if we presume there was adequate staffing, which is questionable, it sounds like there was a great amount of turnover, which to me would not indicate that continuity of care. So do you agree with the assessment we were given that veteran care never suffered? And why or why not?
Ms. Wackler.
Madam Chair, Senator Mitchell, I do not agree that staffing levels were adequate and that care was provided to standards that are acceptable. Again, I come back to reading the MDH report, spring of 2021, nurses working doubles, a nurse on the clock 21 hours straight. These are concrete examples that staffing is tight.
Senator Mitchell.
Can you give an example, or either of the people that you brought with, of an example where you felt that we fell short for and I believe we fell short for the staff, but can you give an example of where you feel that we fell short for the veterans that were in the home?
I want to make sure I have an accurate picture to paint.
Would you identify yourself for the record again, please?
I'm Diane Groth. I'm a former RN at the Hastings Veterans Home. I want to be specific, but I don't know exactly.
I think,
Ms. Wackler.
Madam
Sorry.
Chair, Senator Mitchell, I think for my perspective, I'm a provider, so I function in that arena. So when I think about staffing, I think about provider level staffing. Nurse staffing is a little bit different in terms of how we look at things. I guess I would need to review some of my notes and the materials I provided to Senator Murphy for concrete examples regarding regarding specific questions with regard to staffing and veteran outcomes. Certainly unvaccinated veterans, not per guidelines would be one example. Operational challenges that led to not testing veterans in a timely manner prior to the outbreak would be a concrete example of a poor outcomes for veterans possibly.
Thank you. I don't see any other questions, so thank you again. Senator Jaskowski, I missed you. How is that possible?
Thank you, Madam Chair. Thank you, Ms. Walkler, for your testimony. You mentioned when you came in 2015, you came to a high-performing team, and then it sounded like within a year or two, things had started to change dramatically. Can you review what those items were again for us? And then in your mind, what precipitated the changes?
Madam
Ms.
Chair.
Wackler.
Oh, excuse me. Madam Chair, I'm sorry I didn't catch it.
Senator Jaskowski.
It's okay, Ms. Walkler, it's okay.
In 2016, I did join the team in 2015. The team was very high functioning with our designated site physician, Dr. William Korchak, and the other nurse practitioners. In 2016, Deputy Commissioner Douglas Hughes, I believe, was appointed around in that year. And changes came fairly rapidly with us hearing that they wanted to close the Minneapolis domiciliary, actually. That did not occur with the veterans going to the media, and they were able to keep their homes. The cuts in key positions were our director, medical director, Dr. Korchak, who resigned under duress, the full-time nurse practitioner, the half-time nurse practitioner, all resigned under duress, the staff psychologist, behavioral analyst, the informatics nurse, the nurse educator for the facility, just to name a few. There were many others during that time as well.
Senator Jaskowski.
Thank you, Madam Chair. Thank you, Ms. Walkler. Ms. Walkler, can you characterize what you think was the cause of the duress?
Ms. Wackler.
Madam Chair, Senator Jaskowski. Staff were given no warning or idea of leadership intentions or what a plan was for the Hastings facility. What happened is schedules were changed, so staff could not work those hours. Performance evaluations were downgraded. Many other strong-arm tactics, which really walked the line between illegal and not illegal means of getting rid of staff, are what myself and others witnessed. It was very traumatic because these cuts were very rapid.
Senator Jaskowski.
Thank you, Madam Chair, and thank you, Ms. Walkler.
Thank you. Thank you, Ms. Wackler. Senator Carlson.
Thank you, Madam Chair, and Ms. Wackler. I was communicating with a neighbor on some of the staffing issues at the Minneapolis home, and the comment was made that there were people that were sharing locations, both Minneapolis and Hastings, and that they were short-staffed. And the short staff was, I believe, in some of the service positions. And what happened was that nurses were actually doing laundry and nurses were busing the meals. They were doing things that were totally outside of their scope of practice and what they were there for. And there were others that were doing the same thing that, for instance, physical therapists were not able to make their appointments. And with the issues of the veterans that are starting to use to get the, I can't remember what you call it, but they were starting to change their grip. They had to have physical therapy to open their hands, open their arms, that they were not getting the appointments because the staff was so stretched and they couldn't maintain those appointments. And what I got was a response here from my inquiry to the Minneapolis Veterans Home quality of care and staffing levels received an overall 5 out of 5 rating by the Centers for Medicare and Medicaid Services. I'm wondering if you can comment on that part of staffing. Is that correct assessment?
Ms. Wackler.
Madam Chair, Senator Carlson, to me, I believe you're referencing perhaps the skilled facility versus the domiciliary, and I don't feel qualified to speak on what's happening in skilled. In terms of domiciliaries, many times I saw nurses deliver meals, do laundry, all kinds of tasks nurses were doing. Another employee perhaps could have taken care of laundry, but the nurses pitched in. They did anything and everything they were asked.
Thank you, Ms. Wackler. We have a couple more people on the list who wish to testify. I want to thank you for your time this evening and for your service. Mr. Maxa. Welcome to the committee, sir. When you're ready, introduce yourself for the record and proceed. And I know you've had a long day here, so it's good to see you this evening.
Good evening, Madam Chairman, members of the committee, Commissioner Herkey. Thank you for this opportunity to speak to you on the behalf of the American Legion Department of Minnesota. My name is Mike Maxa. I'm a retired active duty Air Force veteran, and I am currently the adjutant for the American Legion Department of Minnesota. The department is very concerned and troubled by the allegations published in the Pioneer Press regarding the Veterans Home in Hastings. The American Legion Department of Minnesota has a Veterans Affairs and Rehabilitation Committee that routinely visits the Minnesota Veterans Homes and other places where veterans of our state receive care. These visits ensure veterans are being cared for properly. The American Legion's #1 concern is the quality of care of our veterans to receive in our medical facility and our homes, as this is the first pillar of our 4 pillars. The American Legion Department of Minnesota and MDVA have a long history dating back to the 1950s, and both of us want the best culture and environment for our veteran residents to live in and the staff to work in. In the short time since the allegations in the Pioneer Press, the American Legion's Department Service Officer, Assistant Department Service Officer, our Veterans Affairs and Rehabilitation Chair, and I have visited the Hastings home. While we are not able to give you an assessment of the staff issues or the workplace culture today, we can say to you we do not believe the care of veterans at the Hastings Veterans Home was compromised. However, we do have concerns, and our Department Service Officer, Assistant Department Service Officers, and our Veterans Affairs and Rehabilitation Committee will continue to monitor our concerns and to help identify areas needing improvement and commend the best practices of the home. We will be there for assistance to ensure our veterans are receiving the quality care they deserve. Also, we want to ensure the staff has the equipment and supplies to carry out the mission of care in the highest standards for our veterans of Minnesota. We are here to help. As you all are aware, the facilities at the Hastings campus needs a serious overhaul. I feel the conditions our veterans have to live in and the staff have to work in should have been upgraded years ago. The Band-Aid fixes have to stop. And that is why it is paramount our Minnesota legislators approved the $77.7 million in bonding funds for the Hastings Veterans Home. These buildings were constructed in the early 1900s as an insane asylum, and today the veterans receiving care at Hastings do so in an institutionalized setting. Many of the more modern buildings in the Minnesota Veterans Home system have a warm setting. They often feel like home or even a cabin up north. The contrast is stark. An up-to-date, state-of-the-art facility would help to improve the morale of not only the residents, but also the staff. In closing, we support the actions taken by Commissioner Herkey and the Minnesota Department of Veterans Affairs, and we believe the agency has the best interests of veterans at heart. Thank you, and if you have any questions.
Thank you, Mr. Maxa. Members, do you have questions? Thank you for making the visit so recently and coming back and sharing your perspective with us.
And Madam Chair, if I may, real quick.
Yes, sir.
Our Veterans Affairs and Rehabilitation Committee, our Department Service Officer and Assistant Department Service Officer are all new. And one of the things that they really are going to start focusing on is the staff and the veterans, residents of the home, and really dig into that aspect of it. In the past, it was more of a high-level visit with the administrator and the deputy commissioners, but we want to hear from the boots. Thank you, Madam Chair.
Thank you, sir. There are two more people that have signed up to testify. Hillary Grover. And then following Hillary will be Jim Meyer. And then we'll hear back from the commissioner. Welcome to the committee. Please introduce yourself for the record and proceed with your testimony.
Thank you, Senators, for allowing me to be here. My name is Hillary Grover. I was a social work senior at the Minnesota Veterans Home. I've been a social worker since 1999, and my focus of practice has always been on providing mental health care and advocacy during my career. I came to MDVA after 2020. I needed a break from high-stress clinical practice and leadership roles that I had been in. I was excited for my job as a social worker for the DOMS program and even moved from the Rochester area for this opportunity. I worked at MDVA from January of 2021 until leaving on FLMA during November of 2022 due to the continued stress and hostile work environment that was directed at me and many others. I truly loved my job working with the veterans and provided the care and support that was expected of me as my role as a generalist social worker, and I had hoped to stay in this role for the last half of my career. I soon discovered that leadership in the building was overt in showing their power over employees and residents alike. The goal was to lead with fear and intimidation, not to support people to help them thrive in both of their jobs and where they lived. I will keep this short, but starting in April of 2022, there was a direct attack on me, which resulted from me advocating for a veteran and also setting boundaries with leadership by not working outside of my job class. A main function of a social worker is advocating, which I have always done well and with respect. In my career, I have never encountered such a toxic, hostile, and abusive environment. Leadership did written and verbal attacks on me and had also publicly shamed me several times in front of others. My mental health was in a very dark spot and I needed to get away from the environment, so I chose to leave to save my career and myself. There were system failures at every level when I was trying to work through the issues to continue my employment of a job I loved. Investigations and letters of expectation have routinely been used to create an atmosphere of fear and retaliation with all employees. We do talk because we need to support one another. I think removing the deputy commissioner and the administrator is a start, but this culture runs deep and goes beyond them. I do hold the commissioner in part responsible, as he had an opportunity months ago to address the concerns, which resulted in a great deal of loss and grief for me, my fellow colleagues, and veterans. As I listened to his testimony, I I applaud his actions, but I'm not sure a 10-point plan is going to address the longevity of this culture issue. I think how the department is run is very archaic and needs to be modernized to support a modern work staff. Since I am no longer an employee, and no one has ever asked for my keys back, I am returning them tonight as closure for me, but also as a symbol of the failure of MDVA leadership. The keys represent employees who only interest was serving veterans, but were victims of systematic failure by MDVA leadership, MDV Human Resources, and MMB. Thank you for listening to me, and I'll leave these here for the commissioner to pick up later.
Thank you for your testimony. Ms. Grover, members, do you have any questions? Senator Mitchell.
Thank you, Madam Chair. Again, I'm sorry for your experience and thank you for your testimony. In addition to, you said showing power over you, you did also say and over veterans. Mm-hmm. And again, I'm just looking for concrete at the end of the day, we should be treating employees well, but we need to make sure the veterans are getting taken care of. So was there a specific issue you saw in relation to that?
Ms. Grover.
It's hard for me to come up because I'm nervous, but it's hard for me to come up with a concrete example. But I think how code of conducts were run is very punitive towards our veterans who we do treasure. And I think the floor staff that are there are to serve them. I think veterans were treated differently depending on if they were well-liked or if they were difficult. I can speak probably more to that if I had time to process a little bit, but yeah. I think code of conducts were determined. We didn't work with residents to help, create a plan of behavior, but instead they were told what would be taken away or done to them because of this behavior, oftentimes as a result of not getting medication needed, not having enough behavioral health support, and just generally not having enough to do. Often they're lonely and just don't know what to do with themselves and don't have the ability to have good hobbies or relationships because of their complex needs.
Thank you, Senator Mitchell. Okay, thank you for your testimony.
Thank you.
And our final testifier on the list is Jim Meyer, who he testified at our field hearing in Minneapolis.
Box of Kleenex, I might need this.
Welcome to the committee. Please introduce yourself for the record and proceed.
Madam Chair and members of the committee, hello again. I'm Jim Meyer of South Minneapolis, 63B. I am the VP-elect of AFSCME Local 744. I'm a longtime union steward for our highly diverse and now increasingly young population in Minneapolis and Hastings. I want to make clear, I currently work at the smaller Minneapolis domiciliary site, which is administered by Hastings, though it's in Minneapolis. But I did also have 10 years working up in the skilled care center, mostly in building 17 or 21, until I feel I was forced out. As I took on more union representation, I could feel the targeting, and I ran for my safety out of there to the relative comfort, security of the quieter domiciliary on the night shift. And that went well for a couple of years until we have undergone a strange shift of acuity, slowly but surely, with no staffing adjustment. As a matter of fact, we've lost social workers, and now people going between campuses and instability. And when I brought it up, as I said before, I was told, basically, love it or leave it. And so I did speak in January, and I was critical at that time. I was honest. I had an inkling things weren't going quite right out in Hastings because too many good people had left, and most of them are filling rows in the back of this room. But I was not in collusion or coordination with the original whistleblowers. I did not have full awareness that my remarks would dovetail with months and months of hard painful work in Hastings and set off another PR disaster for my current workplace. A lot of testifiers have left. I'm still there. I spoke up, I'm glad to do it. I say another PR disaster because when I first interviewed at Vets Home in about 2008, about 14, 15 years ago, the Minneapolis site was, as we say, in the papers. I went to my final pre-interview with Jill O'Malley and Julia Sandel. They're now gone, of course. I told them, I know it may sound arrogant, but I don't care if I do. I'd like to be part of a turnaround. And I felt we really did in Minneapolis, where I was working for about 5 years until a strange downward culture change took off around 2017, 18. It's now 2023. The Vets Home is back in the papers, and I may still sound arrogant, and I still don't care. I and many others want to be part of another turnaround. I'm 60. I hope it's my last one, and hopefully it's the last one ever at the Veterans Home system. I'm grateful to this body's help the past few months when we battled and thought we had nowhere to go. I was at a town hall meeting a few weekends ago at Wyndham School South, Minneapolis. Former Senator Patricia Torres Ray visited that meeting out of concern, ongoing interest. I told her, there's recent developments at Vets Home. They may remind you of 2017, 2018, when we battled. Chair Murphy, you were there, perhaps others. She almost grabbed me by the arm and had me meet Senator Zainab Mohammed immediately. The new senator and I were already acquainted, you might say, but we've reconnected, and I'm very thankful for her interest, and I hope we can work together. I think she'll be a fresh set of eyes for our culture, our work community at Minneapolis. I want to be part of a turnaround, but no one can do it alone. And I invite all the current downtrodden workers, recent former workers, the residents and their families, and anybody out there, young or old, who has considered work in these broad careers to come in and let's work together. We can get the family vibe and the caring focus back if we insist on it. It can be an enormously rewarding profession, not just financially from extra shifts, but to care for those in need. It's one of the best decisions I've ever made. We have a beautiful, in Hastings and in Minneapolis. In Minneapolis, we have, very beautiful campus near Waban Park and the riverbank, and it's beautiful inside among the workplace. Kind people from Albania to Ukraine, Liberia to Ethiopia, Mexico to the Philippines, Arkansas to Wisconsin. Take it from me, we have also had take it from me as a longtime rep, we've had some fierce union busters. Some are gone by their own choice, some are gone by others' choices. Our people on the workforce have fought through and tried to maintain high care levels despite our system. You've asked many people to spot or to indicate a care breakdown. Well, I don't think a testifier is going to admit, but the nurses I know at Vets Homes, they're not going to let it happen. That work's going to get done, no matter what it takes. Some things can delay, but urgent, timely, important care cannot wait. It's going to get done. So we've had high levels of care. I think we have upheld under the circumstances, but when our own residents dared to speak out in the media to the problems as they did, it's time for a change. And I can honestly say, maybe with one exception in my career, I've never seen all the unions, all the job classes, the different authority levels, all the workers, even past and present in our HR, as unified as they are now for an upward change. And I'm glad to see changes in leadership. Those were necessary, I think, to move ahead. I was at a listening session in Hastings. I worked last night, went to Hastings, and I'm here and I work tonight. But I think there is some new hope with a new administrator in Minneapolis, new leadership in Hastings and at the MDVA level. And I hope they get on board positively and supportively for this hard work we do. One of the saddest things I've seen in my career, it's not even the sick and the frail and the dying and their loved ones in anguish. It's been to look across the table and see good people, good managers, caring nurses, forced to read the demeaning and vicious scripts of our upper bosses against their own valued teammates. I'm sure it's why there are so many former RN managers in our alumni now, and some are ready to speak out. If they were given a platform and testimonial immunity, you would need another hearing, and I don't think you want that. You'd possibly need another special session. I forwarded a few samples that people have volunteered. I'm not even really out there beating the bushes for more comment. We've heard enough, but people are volunteering to me now. Now that the floodgates open, they want to talk. We'll get there. Not everybody's this dissatisfied. Many people are happy in this workplace. They might prefer it to their other place. They might be earning well, especially on the overtime, taking care of their family's health, maybe at the expense of their own health. We score well on broad satisfaction surveys, I'm sure, but I would hope so, because even in my original marks in January, I said, if it's a funding issue, and it may not be. No one says we're not funded with top facilities, but are we well spent? Are we well allocated? Are we well directed? That's the question. I'm reluctant to single out any department for praise at the risk of insulting all the others. We've all pulled together. But I may have implied that our staffing department just couldn't really figure it out at my January remarks. The opposite is true. Our direct staff who are plugging the holes have done a miraculous job of making the best of little, and I hope that can change for them. Also, our PM and overnight officers of the day, like campus managers, they're supposed to be sort of medical overseers managing. They really turn into almost full-time schedulers, begging people to stay, cover another shift, begging somebody to stay a little bit later on that current shift, and then call people at home, can they come in a little earlier to bridge the gap and pull that all together. And I'm thinking of Jasper, Jason, Daguma, Sergey, and Emmeline, who recently quit, Jennifer, who recently quit that position. I don't blame them. I'll conclude to say, I've been getting quiet high fives and thank yous after events this past weekend for speaking up in January and being attributed in the paper. But it was a team effort, and particularly by Lynn Wackler and the first-gen whistleblowers in Hastings. And I'm actually sad and sorry it came to this. It didn't have to be this way. I hope it never is again. I'm going to conclude there. I thank you all twice for letting me speak and for all you may do for us and for all the struggling healthcare facilities in Minnesota in these very challenging times for us. Thank you for listening to all of us. Take care and be well.
Thank you, Mr. Meyer. Senator Anderson.
Madam Chair, thank you. Thank you, Mr. Meyer, for coming forward. I had mentioned earlier about a ombudsman for the group, the Vets Home and the domiciliary. Did you have any conversation with the ombudsman at all regarding these situations?
Mr. Meyer.
Oh, thank you. Madam Chair and Senator Anderson, I've mostly been just busy staying on the work. I've let residents work with the ombudsman. Believe me, I've been on the verge of reporting us in. I was this close a couple weeks ago. I haven't tried the ombudsman. Fair or not, I've heard it's maybe of limited effect, and I think they're swamped. And I pursued other means, but I really was about this close to calling us in.
Thank you, Senator Anderson.
Thank you. Mr. Meyer, you mentioned that when the residents started complaining, you kind of said, oh, if the residents start complaining, then it's time to go forward. But was it before that, or maybe I misunderstood you?
I think we're having a misunderstanding. Pardon pardon me again, Chair Murphy and Senator Anderson. I think we're having a little misunderstanding that is about the rock bottom. When a living resident will speak out in the media against that danger to say something's got to change. That's not when I began to think, oh, wow. That's when I meant a different measurement. I hope I've made that clear now. No, I mean, I've been an observant critic in my facility for years and years. I think you can ask some upper directors. So have I made it clear, or?
Yes,
Senator
I understand.
Anderson.
So, Mr. Meyer, Madam Chair, Mr. Meyer, so you mentioned that you were glad to see a change in the management. Are there other changes that need to be done in the facility as far as supervisors or people in direct oversight of the staff and people who work there?
Mr. Meyer.
Madam Chair and Senator Henderson, it's a big question. I think we have to take it a step at a time. But key to me was the lifting of a feeling that our leadership was leading us wrong or undercutting or just stifling us or scaring us. You know, I think people on the body have asked, why did this take so long to come out? Well, our top leadership did an excellent job of suppressing any discontent, and people would leave. It's a long list of people who just couldn't take it and just got out. So the changes I've seen over the weekend are a start, and I would have to put some thought into all. I've said more clarity about the mission. You know, I struggle with what are we trying to do, or what is success, or you know, why are we at this level, or you know, particularly in the domiciliary going through this weird like hybrid change. Like, why are certain people who seem so out of class admitted in for care and complicating what you thought what the original mission was? If something has to change, let's just be clear about it and guide the workforce into doing best quality. But now it's just a mystery. And then that's stressful on work. And then your performance is stress. It's like, well, I'm not sure if I'm doing a good job because I'm not sure what we're doing. So I'll leave it at that.
So, Mr. Chair, Madam Chair.
Senator
Mr.
Anderson.
Meyer, the former testifier mentioned fear and intimidation and on and so forth and so on. Were you in that same situation where you had fear or been intimidated or to the point of, you know, being pushed into a
In my years up in the skilled care center, for sure. Not so much down. The Minneapolis Dom site is a pretty small, tight-knit family. And I really didn't have much trouble until I went to my now former administrator, humbly went to him and said, it's just becoming out of control. Policy changes are coming one after the other. We're not being taught up on them. The acuity is changing. The staffing is changing downward. You have the power to just keep making these changes for the worse, for the worse, for the worse. And we can't do much about it. But I was one who, with the help of my then RN manager, she facilitated a call. And I said, sir, where is this going to end? We really can't go on like this. And he told me, Jim, if you don't like it, you can leave. And I want to make clear, I wasn't, like, my feelings weren't hurt. I've heard worse. I've been a baseball umpire and a rock critic and whatever. I've heard it all. I was just stunned of like, how do you, if that's your thought process, it probably was time for a change.
Thank you, Senator Anderson. Senator Lang.
Well, thank you, Madam Chair. And I think this is never one of the fun committee hearings that we get to do.
No.
This is a place where, you know, veterans for the most part come and see a lot of bipartisan support. We do arguing pretty well in this committee, Madam Chair, but when it comes to events, we're pretty united front. you know, and I think I've got a bunch of questions written down that I've sat here quietly for a couple hours now, and I think maybe the questions are the important part, not necessarily the answers just yet. As we've gone forward.
Could you repeat that?
Senator Lang.
I said I think the questions are the important part. I think the testifiers that have testified tonight, both from the agency and from the homes, I think your testimony is important, and we, as a legislative body listening to it, are listening, and that's important. Together, we voted and confirmed Commissioner Herkey because we trusted him, and I think we still do. And the movements that we've seen both in the agency and at the homes with employment, I don't know if that's the end of what we're going to see. I think those questions still need to be asked as we proceed forward. Ultimately, taking care of our vets in these homes is what I'm concerned about. And I think that everybody sitting behind this table probably has the same concern. I don't think you're going to get any argument for any of us. I still am asking myself the question in whether or not veteran residents were in danger, and I hope that they weren't. And then ultimately, as a legislative body, our job is to spend money and create policy. So the question to any of the testifiers, and I think the answer could be answered on an individual basis at any given point in time, whether it's through Chair Murphy or any of the members sitting behind the chair, is there something the legislature can do, whether policy, and probably not money now that the targets have come out, but policy-wise where we can make a difference, or is it just possibly now, is it the notification and the openness of the conversation we're having tonight, the TV cameras in the corner and the words that have been printed in the paper, is that enough? And then, again, I think a big thank you is owed to the former employees, to the people that were brave enough to stand up at the testifiers table. And I hopefully a thank you in the future for the agency for responding the correct way. And ultimately, I don't really have a good question, just a long statement. And I hope that makes sense, and I hope that an audience as a whole can look at the committee as we sit here and know that we're committed to fixing the situation.
Thank you, Senator Lang. Mr. Meyer, thank you much for your testimony. Thank you for being here tonight.
Thank you. I'll maybe be in touch. Thank you again. Good night.
You're welcome. All right. That is the end of our testimony. I don't know if you want to join us again, Commissioner, briefly. I know it's been a long day. Welcome back,
Thank you, Madam Chair.
Commissioner.
Madam Chair and committee, what I've heard tonight is reinforces some of the things I've heard previous to this and during my listening session today. I think the veteran acuity is really at the heart of a lot of these issues, and we got to decide if we're going to stay with higher functioning people. I think the current staffing level is probably appropriate. If we continue to take people, as you've heard from the staff, that have a lot of needs, then we probably need to reevaluate the staffing model and determine if additional help or assistance is needed. And if the current domiciliary, there's really nothing in between. That's the challenge. How long do you hold on to a veteran before you send them to long-term care? Because once they're there, that's it. And like I told you, many of the veterans don't want to leave them because they consider the domiciliary their home. But that's one item I took out of today. I came in here and we talked about behavioral health. I think behavioral health needs to be evaluated, because what I heard today during my listening session, I figured about 30 to maybe 40%, and what I was told today is probably about 80% of the veterans have one or more needs in the behavioral health area, whether they're significant or maybe they're less significant, but there are some challenges there. We'll definitely look at the staffing changes, and it sort of plays back to the acuity, but we'll look at the previous staffing changes. We'll make sure that we're covering down on all the areas, and if we need to relook positions or decouple positions or whatever needs to be done to make sure we're covering down, I promise we will do that, and we'll use medical professionals. We'll use some of the experts on our staff here, and we'll also get an outside opinion to make sure that we're going in the appropriate manner. I think you heard that the attitude, which comes from the top, needs to change. I think we made the right decision with the dismissal of both the deputy commissioner and of the administrator. I think it's appropriate based on what you heard tonight. I think it was the right move. It just reinforces that this evening from what I heard. And to be honest with you, a lot of these items were masked from me, and it wasn't until I received that letter which started discussing some of the items with the staff issues that is when I actually use my staff to try to figure out what was actually going on. That's when I became involved, and I've been involved ever since then, trying to get to ground zero as it relates to that. And I can say tonight's testimony, I have a whole list of items here that are beyond some of the discussion items that I've heard before. I think the last item that I circled here was the leadership attitude and approach. I think we need new leadership, and it's incumbent on me and Deputy Commissioner Lindsay to try to find that right administrator that can have that approach that will give us that collaborative feeling at the veterans home that will allow us to go forward, and that all the voices of the staff can be heard, and that we can have a relationship where we're not only friendly to each other and productive, but that we're taking care of veterans, which is the desired outcome in the long run. Those items, the big items, the big buckets that I've heard tonight, and some of these areas, as you can see, I'm already working on. My promise to you is that we'll go forward and we'll make sure that we address all these issues, plus some of the smaller issues discussed. There was a question from, I think, Senator Lang, is what can you do for me? And the facility, I think you heard that from one or more of the testifiers tonight. The facility would really help us to be able to, one, present a better, more appropriate facility for taking care of our veterans. When the veterans come in, they're highly mobile and they want to do things. We should have activities and so forth that are appropriate for them. A new facility would bring 3 distinct areas now into one building based on the pre-design plan that we have, and would allow us to eliminate a lot of the safety issues as it relates to crossing highways and roadways and trying to get to different buildings to get my pills and so forth. And I think would make the overall experience for both the staff and for the residents better. So that would be that one ask I would have for the legislature, is to support a request for funding for the new facility. And with that, I guess we'll stand for any additional questions that you might have.
Thank you, Commissioner. Members, are there further questions? Senator Seeberger.
Thank you, Madam Chair and Commissioner Herkey. I mentioned this when we spoke last week, and I'll reiterate it again tonight. The request for funding for the new improvements and new structure was at the top of my priority list. It was included in the bonding proposal that sadly was not passed due to no support by the GOP, but I've been in discussions with Senator Pappas about how we can make that funding happen. I know it's included in the governor's budget, and one way or the other, Commissioner Herkey, I'm going to do what I can to get that funding for our veterans.
Thank you, Senator Seeberger. Commissioner, I appreciate you being here, for spending this much time with us, for listening, for responding. And as Senator Lang said, I think, the information that we're getting is important. The question for us is what comes next. And you have laid out now here at the close your response to some of the things you've heard, and your what comes next. And I think it'll be important that we stay in touch about that, that we continue to work to make sure that at the goal that we share, that our treasured veterans are getting the care that they need when they need it, and they're living the life that they deserve, given all that they have given to us. We learned about this issue at the start of this term, and it's my intention that we resolve it in this term. But we're going to need to work with you and with the staff at the veterans' homes to make that happen.
Thank you, Chair Murphy, and look forward to you and potentially some of the other members of the committee coming out to Hastings to do a tour. I think that would be important going forward. So whenever you're ready, we're prepared to take you through and show you both the residents and the staff and the facility, so you can get an idea yourself in person.
Thank you, Commissioner. I hope to see you there in April. I also want to thank everybody who came forward, the staff that are in the room and others. There's an anonymous letter. The light of day is a powerful tool to make sure that problems become obvious so they can be resolved. I know it is never easy to blow the whistle, but I want to make sure and say thank you to those who did in service of our veterans. It's important. And with that, members, I'm going to adjourn our meeting. Just a piece of housekeeping. The first of our omnibus bills, the policy omnibus bill, which is made up of bills that we've already heard in this committee, should be released tomorrow evening, and we'll take that up on Thursday. Thank you all very much for your time and your attention to this matter tonight. And with that, our meeting is adjourned.